Thank you. It's such a pleasure to be here. You knew I was going to be one of the speakers because I'm might be the only one with a tie on today. And whenever I wear a tie to work, people expect that either we're having class pictures or I'm going to a wedding or something like that. But anyway, it's a pleasure to be here, and it's a pleasure to talk about program science. In the 1990s, actually, I was working in Winnipeg, working with the provincial health authorities there and also at the university. And I thought I had a sense of how you bring together programs in science. But it really wasn't until I moved overseas in 2000 and had the responsibility of running large HIV prevention programs when I really started to understand how science and programs need to work together in order to improve programs. And so I'm going to reflect a little bit on that experience, and I'm going to try to take a particular set of experiences in one of the large programs that we are responsible for overseas and see how we can use that as a way to illustrate things. So what's science got to do with HIV prevention? Well, first let me talk about what I see as some of the gaps that have emerged between science and programs historically. And one is, I think, a perspective gap. I think that people who come from a scientific perspective or a science paradigm and program paradigms often have different perspectives on what the objectives are. So a science paradigm relies heavily on theory to build knowledge and develop interventions, whereas a program paradigm really relies more on experience and community perspectives to develop the interventions. From a science paradigm, scientists often focus on the internal validity of what they're doing. Is this a good research design? Have we got reliable evidence that we've generated through scientific methods for building knowledge and testing interventions? Whereas programs have to focus on local context and community responses to assess interventions. And then from a science paradigm, scientists are always trying to get their research into practice. They've done research, they spent a lot of their time and energy and resources and ingenuity to try to develop research. And so they have this strong sense, and now they're getting big pushes from funders to get their research into practice. Whereas programs are really trying to understand how they can get research out of their practice. How can we understand what's happening based on what we're doing? So you can see that from the start, programs and science come from somewhat different perspectives, and they have different paradigms. And it's very important to, I think, realize that and see how we can bridge this gap. There's also a practical gap or an implementation gap. The way that science is usually implemented and the way that programs are usually implemented are different. And so you have this gap in terms of how to do these things and how to bring science and programs together. So the scientific paradigm emphasizes an adherence and fidelity to proven interventions. So the idea is to look at and grade evidence from science and think about how we can implement those evidence-based interventions with fidelity. Whereas a program paradigm thinks about adaptation to local situations and flexibility in design. So you see we have this tension between the fidelity to what's proven versus the program need to be able to adapt. From the scientific paradigm, there's this idea that there needs to be clear, measurable indicators to assess progress and effectiveness, whereas programs often give priority to experiential evidence and key informant feedback to measure success. And then from a science paradigm, it's often constrained by a lack of robust program contexts. And so science tends to look at programs and develop its knowledge through fairly narrow windows that are provided through where they can actually conduct the research. They don't really have a robust program context in which to conduct the research. On the other hand, programs are often constrained by resources and expertise to engage in research. And so we have these tensions both with respect to perspectives and then with respect to the implementation of science in the context of program, depending on whether you're coming from a science or program paradigm. And so I think the impetus for the program science construct and the program science initiative is really to try to bring these paradigms together and think through how we can close some of these gaps. I'm going to illustrate this. When I was putting this talk together, I thought, how can you sort of talk about this? And I thought really the only way to do this is to illustrate it, and illustrate it through the eyes of a program and the program perspective, and thinking about how does science fit within a program. And so that's what I'm going to try to do. And I'm going to illustrate it from a global context using a large program that we've been involved with amongst female sex workers in India. So I'm going to start from a program, and what does a program look like? And this is a very recent publication from a number of organizations that got together, including the Network of Sex Work Projects, to try to define what a program for female sex workers, or for sex workers, both male and female, should look like. And here you can see that the program has identified 3 main domains and then subcomponents within a program. And I think it's really important when we think about science in the context of programs to really understand, well, what are the components of a program? What are we trying to achieve within a program? And then the science has to fit within that. So if we look at this, we have, and I've started in a different order than they've numbered them, but if we think about starting, managing, monitoring, and scaling up, this is really one component of the program. And so we need to think about that component of a program. We need to think about community mobilization and structural interventions and how that fits within the program context and what are the different components of that. And we need to think about the fundamental prevention, care, and treatment interventions that will be part of the program. So if we think about a coherent program in the context, in this case, of sex workers, we need to think about the different components of a program and the complexity of fitting those pieces together within a coherent program. And I think the challenge is, the program science challenge, is to think about how do we embed science within this construct. And you'll notice that what I've tried to do here is to show that science isn't outside of the program, giving guidance to a program. Rather, science is trying to find ways of embedding itself within the fundamental components of a program. And I think this is really the paradigm shift that we need to move to, is to think about what is the program doing? What are the program approaches? And then how does science fit in? Rather than the idea of science trying to guide programs through the evidence that they generate, quite often external to the program. And this is, I think, the fundamental challenge. So if we're thinking about the domains of inquiry, within a program science framework, we need to couch them within the key components of a program. So if we're thinking about starting and scaling up programs, we need to think about how can science tell us about the size and distribution of the population, and how can we optimally distribute program resources. So this is really that task of managing and scaling up the program. If we think about the prevention, care, and treatment interventions, we need to define the service needs and opportunity gaps in terms of programs. We need to also help to guide the micro-planning and service delivery processes at the local level. And then for community mobilization and structural interventions, the challenge here is to define what are the key vulnerabilities and constraints affecting the community and understanding the empowerment processes. Now, I think that any good research program that's looking at HIV prevention does these things. You'll find research in any of these areas in discrete research projects, and there's many scientific investigators that are addressing all of these issues. I think the difference is that how can we embed all of these components within a program, not doing them in isolation. It doesn't help a program to do a single research study in one of these domains. Well, it can help the program, but it's not optimal if you don't embed the research through all of these different components, because a program doesn't start when it doesn't stop once it gets a little bit of evidence from one of these domains. It needs to really think about all of the comprehensiveness of the research needs across all of the program domains. So let me illustrate this. So this is based on the work that we've done with scaling up the sex worker programs in India. And I'm just going to take each of these knowledge domains and try to illustrate how we've used, in some cases, very basic methods of inquiry to try to embed this idea of building knowledge within the context of a program. So starting with this idea of how do we scale up, we started with this basic concept of how do we understand how to distribute our resources. So we needed to understand where's the population that we're trying to reach? Where is the community? And when you're looking at this at a large scale, you need to really decode this into locations and people. And so we wanted to get the right footprint for the program to make sure that we're reaching scale. So this is just a very basic concept of locations, and within those locations, the people that need to be reached, the community that needs to be reached there. And so we engaged a process whereby we worked with local community members to do this very extensive mapping process. And it started at a very local level so that we had town by town, zone by zone within a city. We engaged members of the community, in this case sex workers, to help us map out what were the locations, what were the concentrations, where was the community, and where did it need to be reached. And this was to help us develop the program footprint. How do we distribute our resources? So we needed to understand the places and the people that we needed to reach in those places. And so we developed basic methodologies to work with communities to try to define this. And this is an example of a local mapping exercise. So these local mapping exercises were translated into city maps. And you can see we're not using very high technology here. We're just trying to understand where are the concentrations and where is the community and where does it need to be reached through outreach and service delivery. And then that gets converted up at larger scale. So now we're up to the level of a state of 65 million people. And understanding this is the general distribution of sex workers. And then converting those micro level maps and this general distribution into a program footprint whereby you have service locations and program locations involving outreach programs and local services, which are distributed based on that mapping. So at the end of the day, the program footprint has to map the finely grained information about where the communities are. And so this shows a map of all of the service delivery points. And each of these service delivery points has been defined and calibrated based on that local mapping. So it's starting at that sort of grassroots level and bringing that information up so that when decisions are made about where to put service delivery points, it's made based on that local information. So this is sort of embedding these inquiry processes into the planning and scaling up component. And so at the end of the day, what we end up with is a program footprint, which is very large, but it's based on this sort of finely grained information about where the service needs are. And so all of the planning, whether it be the peer educators, the other outreach staff, the project service delivery points, all of those are oriented to the footprint that's required. And then I'm going to move into the second component. So now we've got this program scale and we've got this program management structure. Now we need to understand how we're going to deliver the actual programs and services. So these are the basic prevention services, the care and treatment services at the local level. And so what we need to do here is at each of these spots that's been now located and resourced, we need to think through how we're going to increase the availability of services at each of these locations. And this is an example of this is a schematic example of that process. So for this, we developed methods and tools to work with communities to do micro-planning. So spot by spot, the spots have been mapped. We now have resources put in place to engage community members at each of these spots. And now we just use some very basic tools and methods to develop these spot-by-spot profiles. What is required at each of these spots? And so at each spot, there's this micro-planning process. And again, we involve the members of the community at each of these spots to do this in a standardized way. So this is an example of developing a peer outreach plan. So based on the local map, community members went through a process of defining how many peer educators were required, where would each of the peer educators work, what would be their responsibilities, when would they work, what would be their objectives and goals in terms of reach. So developing these processes involved engaging community members and giving them standardized approaches for doing the planning processes and developing methods and tools for doing this. We also wanted to come up with a mechanism so that everybody within the project was able to monitor progress. And so the very basic unit for measuring progress in this case was a peer education card. So because most of the services are organized, managed, and delivered through peer educators, we wanted to have a way whereby peer educators could track what services they were providing and then summarize these services in a way that they could plan their daily and weekly activities. So as you can see, it's mostly a visual cue card because about 90% of the peer educators are not literate. But it was a way of capturing the same kind of information. And then this information was assimilated at the local level, at the district level, at the project level, so we could track progress. So at each level, we could take decisions about where our opportunity gaps were. So a peer educator could decide what her gap was. The district coordinators could decide where they were having gaps. And it was really a problem-solving tool. So here's an example of an opportunity gap analysis in one city that a field outreach team had developed. So each of these columns is one peer educator. The top is the number of sex workers that each peer educator has responsibility for. And then each of these rows are different components. So how many how many of the sex workers within each of the peer educators' domains has been reached at least once? How many have come to the clinic? How many have received enough condoms? How many have participated in group activities? So at a town level, each of the peer educators can assimilate the results from their peer educator cards to identify where are their gaps. And then there was a process for each of the peer educators and as groups for them to analyze what were the gaps and what were the constraints that they were facing, whether it be in outreach or mobilizing people for services or engaging them in community strengthening processes. So this is sort of an iterative process that was continuously analyzing what the gaps were and why the gaps were there. I think it's really important to emphasize that the monitoring process here wasn't to evaluate whether the program was doing well. It's much too early to do that. Instead, this is a problem-solving process. So when we encourage peer educators, outreach workers, and other staff within the program to track their progress, it wasn't so that we could say who was doing well and who wasn't doing well. It was for us to identify what were some of the systematic challenges that were being faced at every level. So peer educators could themselves come together and think about strategies for closing some of their gaps. And at different levels, we could look at what were the constraints that needed to be addressed. And then even at a project level, we were able to then summarize this information using very simple indicators. So if we look at the estimated number of sex workers, the number that had ever been contacted, the number that had regular contact, the number who had visited the clinic, these were just some very basic things. The peer educators had this information for each of their spots. The district program outreach staff knew this for each of their locations and zones. And at every level, people were tracking these same kind of indicators. So it's a systematic approach, but it's coherent from the grassroots level all the way up to the state level. And we could look at where we were running into issues. Is it in the initial contact? Is it in maintaining regular contact? Is it in mobilizing people and providing access to clinics, etc.? And now I'm going to move on to the third domain. And I'm going through this very quickly, but I'm just trying to illustrate the scope of embedding science into different components of the work. So I'm now going to focus on the structural interventions and community mobilization to address vulnerability, stigma, and discrimination. I think this is an area that really has not generally been done well. And I can't say that we haven't run into our struggles with this, but I'm going to try to illustrate that we can also incorporate science into looking at these aspects of a program. So one of the first things that we did was to try to find ways so that community members could identify the key challenges that they were facing and the key constraints that they had in terms of their risk and vulnerability. And we used a number of different methods, qualitative methods. We used, the usual in-depth interviews and focus group discussions, etc. But we also tried to use other ways. What we found was that often partly because of power imbalances between community members and researchers, we found that the communications were a little bit stilted. And so we actually found that things like getting women to represent the issues through poetry or songs or through, in this case, drawing, visual representations, to try to describe what were some of the issues and then let them talk about that. And so we found that these kinds of ways of communicating broke down barriers in ways that doing sort of standardized interviews or focus group discussions weren't able to do. If we were able to look at these visual representations or songs or poetry, we were able to try to decode and understand, break down some of these communication barriers. And so this is an example of a workshop where, and these workshops were done everywhere, where we tried to get the local perspectives on what the issues were, both as individuals but also as communities of sex workers. And we found a number of different themes that emerged out of this inquiry. So poverty and low social standing was seen as a major issue. There is an economic dependency and lack of power over resources, lack of access to health services and other social entitlements, lack of education and skills to negotiate with government and other power structures. There were also a lot of overlaying moral and legal aspects, and these promotes and sanctions harassment, exploitation, and violence by police, power brokers, members of their own families and communities. And I think one of the things that really came out in some of these inquiries was the internalization of stigma, resulting in feelings of unworthiness and lack of entitlement to human rights. And so this was a common theme where sex workers were clearly expressing that in many cases they didn't feel that they deserved better health services. They didn't deserve better social entitlements because they had this very strong internalized stigma. And I think HIV was sort of a pervasive issue that they dealt with in terms of stigma, because they were seen as a threat to the community. They were, and this really accentuated their social exclusion and stigma and discrimination. So these themes emerged out of these inquiries, but each district was different, and each town was a bit different. And so we tried to localize these issues and tried to emphasize. In one town, violence and police harassment might be a really dominant theme. In another town, it may not be a very big issue, but there may be other issues that women were dealing with. So we tried to make sure that the mix of structural interventions was really related to what the local challenges were, and use this way of being very, very particular about what the responses were. But we came up with a general set of structural interventions that were tailored to each context. So one was to really address public attitudes and stigma. Another was social and economic issues, and another was violence and exploitation. So these themes wove their way into our programs, and we came up with a number of different kinds of responses, like media advocacy and supporting local organizations to address public attitudes. The social and economic issues, we strengthened community-based organizations and actively tried to promote access to social entitlements through advocacy at different levels. And then for violence and exploitation, we did a massive program on police sensitization that continues to this day. But we involved more than 40,000 police officers in sensitization trainings, where community members came and helped run these workshops with local police, establishing a crisis response system, and developing a legal empowerment framework so that every district had legal support for the community-based organization. And we were able to demonstrate fairly major changes in the attitudes, for example, of police officers over time. So that after the sensitization training, we saw that there was really a changing of dimensions. Yes, thank you. And we saw declines in violence over time, which we like to think is associated with the program. And so the proportion of women that reported being beaten or raped in the past year had declined significantly over a period of time. And this was associated with program contacts. We also worked a lot on community mobilization, forming collectives, because we saw that this was something that women didn't really feel a sense of belonging, didn't have a sense of common action with other sex workers. And then we tried to analyze this empowerment through specific domains of action. So we looked at power within, the issue of self-esteem and confidence to participate in meetings, and the power with others, the idea of confidence and the ability to work together and support each other, and power over resources. And we tried to codify this and analyze it in an overarching framework that emerged out of our program. So when we thought about our program and structural interventions, along with community mobilization and the local socio-demographic characteristics of women, we tried to understand how we could measure and track the empowerment dimensions, the power within, the power with others, and the power over resources, and use these as ways of understanding their power to address the power imbalances, the social exclusion, and vulnerability. So we've tried to now sort of understand how the program emerged and how the program was affecting these domains. And we actually measured it. And we were able to show that in districts where there were much more strong community-based organizations and much higher participation in community-based organizations, we found that the power within, the power with others, and the power with, this is power over resources, that these were much stronger in the districts that had stronger and older community-based processes compared to those districts which didn't have those processes. And we also found that younger women scored lower in all empowerment domains. So we've tried to really emphasize more engagement of the younger sex workers. Very large differences between districts. And we found that duration of time exposed to the programs and the number of program contacts was particularly associated with power within. We also found that power within and power with was associated with greater self-efficacy for risk reduction, like condom use with regular partners, and higher service utilization overall. And that power with others, this domain of measurement, was associated with greater autonomy, reduced reported violence, and increased self-efficacy for service utilization. So we're trying to understand and communicate to both program people as well as policymakers how important these structural interventions are for HIV. And then I'm just going to close with saying that we've also measured the overall program impact. This is work that was done by an external group. London School of Hygiene and Tropical Medicine and Imperial College has done an evaluation of the sex worker program, and they've tried to look at the total HIV infections averted each year. This is just for one district, and the estimated proportion of all infections within the district that have been averted by the programs. And you can see that they've come up with fairly high estimates for the impact of the programs, and we've got this. They've done this analysis for a number of districts. So what are some key lessons? I'm coming to the close now. So first, I think integrate science with programs at all levels and stages. I think this idea of embedding science with reflective practitioners is really a model we need to move towards. I think it's done in different contexts, but I think we need to do it more systematically. We need to form sustained supportive technical relationships with public health programs with purpose of technical assistance, and I'll talk about that in the discussion perhaps. We need to develop platforms for learning and innovation, and we need to measure all of the key program processes, but don't overload the monitoring systems. This is sort of my experience from a program perspective. I just want to say that this idea of program science is being captured in a global network. There's a global program science group that involves academic institutions and key policy leaders from the World Bank and Gates Foundation and UNAIDS, etc. And we're trying to get experiences from different countries, package them, and disseminate them for other global bodies and other countries. And some of the methods that we're using for knowledge translation is developing these program science platforms where there's science embedded within programs at the national and state level. And we're focusing on this iterative evidence planning implementation. Learning sites, learning about what works and building capacity for others. And then developing this knowledge synthesis and dissemination process for country-to-country learning, as well as packaging lessons for global dissemination. And these are my two questions. Maybe I'll leave those to the end, but I do have two questions that we can deal with. So I'm going to thank you for your attention and look forward to our discussion.